This is Dr. Jeff Dash again. We're going to go through the information that I promised to show you. Uh, Again, we're going to talk about the typical menopausal symptoms, and then we're going to talk about uh, why estrogen is breast cancer protective. We'll show the proof in the medical literature that shows that estrogen prevents breast cancer. This material is taken from my new book entitled Bioidentical Hormones 101, second edition. This is available on Amazon for 99 cents per volume. There are 3 volumes. It's only 99 cents. All of the medical references are listed, and everything is heavily referenced. So this talk is the introduction to my book, and let's get started. Put on your seatbelt, hold on to your hat, and let's get started. We're going to talk about the benefits of hormone replacement, firstly, and then secondly, we're going to talk about the fear of estrogen that's prevalent over the last 20 years, which has been completely changed by new research data, which we will go over shortly. My office is on Griffin Road in Davie, Florida. This is my office phone number, 954-792-4663. If you're interested in our services, we specialize in bioidentical hormone replacement and also natural thyroid. I'm also a thyroid expert. We deal with autoimmune thyroid disease, Hashimoto's, and other thyroid disorders using natural thyroid. Please give the office a call, and the secretary will arrange for you to meet by telephone, have a telephone call with Dr. Fine, who will discuss everything you need to know about the office and answer all of your questions about our program. Let's jump into benefits of hormone replacement. This is from chapter 1 in my new book, Bioidentical Hormones 101. Typical symptoms reported are hot flashes, night sweats, insomnia, joint pain, loss of bone density, loss of cognitive function, brain fog, vaginal atrophy. So hormone replacement relieves all of these symptoms. And this is heavily documented in the medical literature, which all the references are in my book. Libido is improved with testosterone. Genitourinary symptoms such as urinary tract infections, recurrent urinary tract infections are commonly reported. This is all relieved by hormone replacement. Mood swings, depression, excuse the spelling, all relieved. Weight gain is typically reported after menopause, and that's because of estrogen deficiency. The estrogen improves bioenergetics and allows for weight gain. Hormone replacement improves the skin and the hair, relieves the dry eye syndrome. The studies show an almost 40% reduction in all-cause mortality when the hormone replacement is started early, in ages 50 to 59, shortly after, within the first 10 years after menopause. Studies show a 60% reduction in colorectal cancer. There's a 30% reduction in new onset diabetes. Wound healing is enhanced, muscle mass, muscle strength, aches and pains are all relieved and improved. Hormone replacement is anti-inflammatory. Menopause is an inflammatory condition, and hormone replacement reduces all this inflammation. The retina and the macula especially are estrogen-dependent organs. We know from the studies of women taking estrogen blocking drugs, they will have increased risk of retinopathy and macular problems. So estrogen, that's strong evidence that estrogen prevents retinopathy and macular degeneration. A short history lesson on the history of hormone replacement. Before 2002, hormone replacement was considered beneficial, and it was widely offered. And there was a considerable population of women, postmenopausal women, using hormone replacement. 2002, everything stopped, and that's because of the Women's Health Initiative study, which was published in 2002. The first arm used synthetic hormones, medroxyprogesterone, which we know now is carcinogenic. The mass media immediately trumpeted the message that hormones cause cancer. There's an increased cancer risk with hormone therapy. This is the New York Times in 2002. Hormone replacement shocked the medical system. Here's Time magazine in small print. It says hormone replacement therapy is riskier than advertised. And this was, of course, the 2002 first arm study, which was a large NIH-funded study, 10,000 women randomized to hormone replacement versus placebo. And the hormones used were horse estrogen called Premarin and a synthetic progestin called medroxyprogesterone. They did not use human hormones. And of course, when this study was published, the data was published, this is when the fear of estrogen began because this study data showed increased risk of breast cancer and blood clots. Here is the actual publication title, which was published in JAMA 2002. Jacques Rousseau was the lead investigator. He's a cardiologist working for the NIH, and he was the lead author. So here's more in the mass media. As soon as the study was published, Science Daily, their headline says hormone therapy study, which is the Women's Health Initiative study, was stopped due to increased breast cancer risk and lack of benefit. This was in July 2002. Here's another one, BBC News, hormone replacement, HRT, hormone replacement therapy linked to breast cancer study stopped due to increased risk of invasive breast cancer. That's August 2002, the following month. That was in Oncology. This is another one, Oncology News International. So let's take a closer look at both arms of the study. Remember, there are two arms. The first arm, which published in 2002, used the synthetic estrogen and progestin. The second arm was estrogen alone. That was published in 2004, and that was completely ignored. So here is both arms of the study, Women's Health Initiative study, along with the data from a different study called HERS, published around the same time. And this is from JAMA 2004, Stephen Hulley and Deborah Grady. So here's the data table showing breast cancer hazard ratio was 1.3 for HERS using estrogen and progestin, and 1.26 for estrogen estrogen plus progestin in the Women's Health Initiative. This is the first arm 2002 study. Notice the roughly this similar increased risk for breast cancer. This is 30% increased risk, and this is a 26% increased risk for the first arm 2002. Here's the second arm published in 2004, where this was estrogen alone. They used the Premarin, the horse estrogen, but only by itself without the synthetic progestin. Notice we're getting a 0.77, which is below 1, which means a 23% reduction in breast cancer in the group using estrogen alone. So this shows a benefit of estrogen, which was not published in the medical literature. It was published in this was published in the medical literature, but not the mass media. So again, second arm showed 23% less invasive cancer. These are the actual numbers. 94 cases of breast cancer in the estrogen group, but 124 cases of breast cancer in the placebo group. This actually shocked the medical system because everyone believed that, of course, we know that estrogen causes breast cancer, but there were 94 cases, but it was less than the placebo group. Now, when we follow this same patient group, 5,000 women taking Premarin alone over a longer period, over 18 years, we see even more dramatic uh, reduction in mortality from breast cancer. So here, this is the study that published that information by Joanne Manson in 2017, and this is in JAMA, the Journal of the American Medical Association. And here's the data table taken from Joanne Manson's report, which is the data from the Women's Health Initiative, the Premarin alone, the estrogen alone group, compared to both arms, compared to the synthetic hormone group. So here the top numbers here. The top row is the first arm, published in 2002, of the women who took the Premarin with the synthetic progestin compared to placebo. And the second row here is the second arm, 2004 study of women who took the Premarin alone compared to placebo. And these numbers here are the breast cancer mortality in the hormone treated group versus placebo. Notice the placebo groups on both first and second arms are about the same, 40 deaths in the placebo group, both in each placebo group. But take a look over here. We have 61 deaths in the synthetic hormone study published in 2002, but only 22 deaths from breast cancer in the estrogen alone group. And these are the hazard ratios. Red ellipse is increased breast cancer by 44, increased breast cancer mortality. These are women who actually died from breast cancer. 44% increase. That's reflected in these 61 is greater than 40. And here with estrogen alone, we have a 45% decrease in mortality from breast cancer compared to placebo, 41 versus 22. The 22 is the estrogen treated group, which had a dramatic reduction in mortality from breast cancer. There were still women dying of breast cancer, 22, but it was half that of the placebo group, the women who did not take hormone replacement. So the benefit of hormone replacement taking estrogen is obvious here. And this is a randomized controlled trial. This is the gold standard in medical studies. So here is also another article on the same data from Dr. Howard Hodis, who's a professor of cardiology at the Keck School of Medicine, University of Southern California. The second author of this study, published in 2018, was Philip Serrell, who is a professor of obstetrics at Yale University School of Medicine, and this was in Climacteric 2018. This is what Dr. Howard Hodis writes in his article about the Women's Health Initiative Premarin alone study, which was published in 2004. After 18 years of cumulative follow-up, breast cancer mortality was significantly reduced by 45%, hazard ratio of 0.55, which is the data I just showed you. And he's commenting on it in his study, which is published in Climacteric in 2018. Here's another prestigious oncologist in 2019, Dr. Rowan Shablowski, who is an MD PhD chief of the medical oncology division at UCLA Medical Center. And this is what he writes in 2019. All postmenopausal women using estrogen alone have potential benefit with reduction in breast cancer, while all postmenopausal women using estrogen plus the synthetic hormone medroxyprogesterone have risk of experiencing an increase in breast cancer. Exactly what the study showed and what we've been saying all along, going back years now. And again, to restate the obvious, here is Irene Lambrinidaki published her article in 2020, Case Reports in Women's Health, and she says again, restating the obvious, excess risk of breast cancer with hormone replacement is mainly conferred by the progestin, the synthetic progestin, and these are three examples commonly used. The medroxyprogesterone used in the United States, Norethindrone is commonly used in Europe, especially Finland, and levonorgestrel is commonly used in birth control pills. So these are all synthetic progestins. So the next question is, well, what is the mechanism by which synthetic progestins increase risk for breast cancer? And we're going to talk about that next. But first, let's talk about the fact that we have animal models going back to 2009 in mice, where medroxyprogesterone is used to induce mice reliably in mice. For example, if you go to your local university and ask the researchers, the PhD researchers, how do you induce breast cancer in your mice to study breast cancer? They'll tell you, well, we give them medroxyprogesterone, and that will induce a breast cancer in 80% of mice. These are wild-type mice. Over a year, 80% of the mice will have breast cancer. What about estrogen? Can that be used as a model to induce breast cancer in mice? No. When studies have been done showing when you give estrogen and progesterone, hormone replacement to menopausal mice that have their ovaries removed and have been injected with breast cancer cells, the estrogen and progesterone prevent and reduce the incidence of breast cancer in mice. So again, the synthetic medroxyprogesterone induces breast cancer in mice, but estrogen cannot do that. So again, what is the mechanism for progestins, synthetic progestins, right here, synthetic progestins, increasing breast cancer in humans and in animals? And here's Dr. Stephen Burrell explaining the mechanism. It's the disruption of androgen receptor signaling. The progestins block the androgen receptor, and that induces increased risk for breast cancer. So here's Dr. Amelia Peters in 2009. She studied androgen receptor inhibition of the estrogen receptor alpha in breast cancer, and she showed that inhibition of the androgens prevent breast cancer because they inhibit estrogen receptor alpha, which is, remember, there are two estrogen receptors, alpha and beta. The alpha receptor is proliferative and thought to be associated with breast cancer. The beta receptor is protective and tumor suppressor. So the androgens, like testosterone, inhibit the alpha receptor, and that's why it is breast cancer preventive. The progestins block the androgen receptor and preventing the protective effect of testosterone. So this is why we always use testosterone as part of our hormone replacement program to get the benefit of breast cancer prevention. Here it is again. This is by Dr. Teresa Hickey, 2021, published in NatMed. The androgen receptor is a tumor suppressor in estrogen receptor breast cancer. So we're going to stop here. And again, all of this information is in my book, Bioidentical Hormones 101, plus a lot more. There are 30 chapters, 3 volumes. Each volume is 99 cents. There's also audiobooks. If you like the audiobook, you can download the audiobook for free if you use the free trial on Kindle. This is all on Amazon. Please feel free to take advantage of that. This is again our office, which is located in beautiful Davie, Florida, on Griffin Avenue. You can contact our office at this number, 954-792-4663. This is also the website where you can find a lot more information. And please sign up for the free newsletter, which comes out on the 1st of the month. Thank you again. This is Dr. Jeffrey Dach, Medical Director of the TrueMed MD Clinic. We specialize in bioidentical hormone replacement for menopausal women. It's highly beneficial. In my opinion, hormone replacement is the most beneficial, most important and beneficial medical intervention for menopausal women. Uh, we also specialize in natural thyroid and for in the various thyroid. We treat pretty much every type of thyroid disorder. So if you're a menopausal female and in need of hormone replacement, and you're also taking thyroid or think that thyroid would help you, please give us a call. We're going to say goodbye now. Have a nice evening.